My chosen research question is, does having a nonverbal child with autism affect stress levels of parents? The independent variable is nonverbal children with autism, and the dependent variable is stress levels of parents. My hypothesis states that parents with nonverbal children with autism will have greater stress levels than parents of non-disabled children. The two following measurements I will be using are 1. The Parenting Stress Index Assessment, and 2. The Questionnaire on Resources and Stress. The Parenting Stress Index, also known as PSI, is an 120-item self-report measure that assesses negative outcomes associated with the parent-child relationship and identifies the source of the stress. This will be helpful in measuring parents' stress specifically to their handling of their nonverbal child with autism when he shows aggressive behavior or outbursts, sleepless nights, hyperactivity, and negative sensory responses that will later be compared with the stress levels of parents of non-disabled children. The Questionnaire on Resources and Stress is a 285-item questionnaire with 15 rational non-overlapping skills. This will be helpful to better understand the stress outlines of the parents based on outliers like financial troubles, poor health mood, lack of social support, social obtrusiveness, etc. These examples are some of the 15 scales used in the questionnaire. To test for reliability, I will use the test-retest reliability method. This is necessary because, for example, nonverbal children on the autism spectrum usually need a well-structured daily schedule in order to function to the best of their abilities. When their schedules become altered or rearranged, this can have a detrimental effect on the child, which will likely bring out serious aggression and other negative factors that are likely to bring out stress on the parents. Like parents of children with autism, parents of non-disabled children also get mixed-up schedules sometimes, and disrupted routines can frustrate any child. The test-retest reliability method would help better understand if the stress levels were regular for the parents or just a response to an off week. My population of interest will be parents of nonverbal children with autism spectrum disorder and parents of non-disabled children in Maryland. My overall sample frame will be parents of first-grade children from my son's elementary school in Rockville, Maryland. My sample size will be 12 parents. 6 of the parents will be those of nonverbal children with autism spectrum disorder, and the following 6 will be parents of non-disabled children. This study is non-experimental. The research is correlational and will identify if there is a relationship between increased stress levels in parents that either have non-disabled children or nonverbal children with autism, and then comparing which results of stress levels in parents were greater.